Dr. Peeperkorn, good morning. This is the technical moderator from Geneva.
Hello.
Good morning. Good morning, Dr. Peeperkorn. Do you hear me well?
I hear you well, yeah.
Could you switch your camera on, please?
Oh, that's not working. Yeah, all right.
Here we are. Perfect. Perfect. May I ask you to adjust a little bit your camera in order to take away a little bit?
It will be very difficult. We always have an issue with this camera, so I think it's the best I get.
Okay, thank you. Thank you very much.
Okay, well, Enrico, thank you very much, really. We may start now. So good morning, everyone. Thank you very much for joining us on a very short notice, and also thanks to our colleagues in the UN Information Service for facilitating this press briefing. Some of you have seen the post from our Director General, Dr. Tedros, last evening on different platforms about the visit that WHO made to 2 hospitals in north of Gaza and what they have seen. So what we wanted really is to share with you exclusively this morning what our teams have seen and what's the current situation. So as you have seen in the media advisory, we have Dr. Peeperkorn, that you know very well by now, who is joining, and he's also joined by Sean Casey, who was in the WHO team visiting hospitals yesterday. He is leading emergency medical teams for Gaza. So let's start immediately with Dr. Peeperkorn, and then we will hear also from Sean. Dr. Peeperkorn.
Thank you very much. Good morning. Can you hear me?
Yes, we can hear you.
Okay, so let me start with this. So yesterday, on 20 December, in another high-risk joint mission, a team from the World Health Organization and other UN partners, the United Nations Office for the Coordination of Humanitarian Affairs, OCHA, and the United Mine Action Service, UMAS, and the United Nations Department of Safety and Security, UNDSS, reached Al-Ahli Arab Hospital and Al-Shifa hospitals in the north of Gaza. So the initial plan was to deliver fuel to both facilities, but we had to ship through supplies due to the lack of safety guarantees in place and clearance issues. Our teams delivered 7 pallets of medical supplies for surgery, wound treatments, supplies to support women during birth, delivery, IV fluids, and medicines. And they witnessed the impact of the recent attacks on both health facilities and the level of destructions. So our staff are running, you will hear later from them, are running out of words to describe the beyond catastrophic situation facing remaining patients and health workers. So WHO, and actually I just come back from Gaza. I spent there more than 2 weeks, and I was part of that mission. We visited Al-Ahli hospital over a week ago. And then, and I think I reported on that, it already looked like it was utter chaos. It was completely congested, and we described it as a disaster zone. But it was still operational, partly operational, but it had a working operation theater. And some two medical specialists and constantly busy with trauma and trauma surgery. Now Al-Ahli is a shell of hospital. Until 2 days ago, it was the only hospital where injured people could get surgery in northern Gaza. And that was overwhelmed with patients needing emergency care. But there are no operating theaters anymore due to the lack of fuel, power, medical supplies, and health workers, including surgeons and other specialists. It completely stopped functioning and is only operating as a hospice currently with no or very little care. Only 9 out of 36 health facilities are partly functional in the whole of Gaza. All of these in the south. There are actually no functional hospitals left in the north. Al-Ahli was the last one, but is now minimum functional. Still treating patients, but not admitting new ones, along with Al-Shifa, Al-Ada, and Al-Sahaba Hospital. So these hospitals are still sheltering also thousands of displaced people. At Al-Ahli, currently about 10 staff, all junior doctors and nurses, continue to provide basic first aid, pain management as much as possible, wound care, and trauma stabilization services. 80 injured patients, so that more than a week ago, there were still 250 patients there. 80 injured patients, including elderly, women, and small children, are sheltering in a church and as well and on the wards within the hospital grounds. And it's orthopedic section. Many of these patients have lost family members and don't have anyone to bring them water or food. Some of them are severely injured and have been waiting for surgery for 2 weeks. Others have been operated on but are now at risk of post-operation infection due to lack of antibiotics and other drugs. All these patients cannot move and need to be transferred urgently to have a chance to survive. Bodies from recent attacks are lined up in the courtyard and they can't be given safe and dignified burials. More than 20 Al-Ahli hospitals were arrested on 18 December. 6 were released and forced to go south. From the other 40, there's no information currently regarding their detention. And WHO reiterates its call for all parties to the conflict to respect international humanitarian law and for the protection of health workers, patients, health facilities, and ambulances at all times. WHO will keep striving to supply health facilities in the northern Gaza, but without fuel, staff, and other essential needs, medicines, medicines won't make a difference, and all patients will die slowly and painfully. Over 20,000 people now have been killed in the hostilities in Gaza. This is actually almost 1% of the entire population. WHO calls again for a humanitarian ceasefire. This is needed now to reinforce and restock remaining health facilities, deliver medical services needed by thousands of injured people and those needing other essential care, and above all, to stop the bloodshed and death. I would like to hand over now to my colleague Sean Casey, who was the team lead of the mission yesterday to Al-Ahli and Al-Shifa hospitals.
Thank you, Dr. Peeperkorn. Just before we hear from Sean, we will share remarks of Dr. Peeperkorn. I also put in the chat for those who have not seen the comments by Director General last night on this visit. Sean, please, the floor is yours.
Thanks very much. Good morning, colleagues from Gaza. I'm currently in Rafah. In the past few days, we've undertaken 2 missions to the north. One on Saturday to Al-Shifa Medical Complex, which is the largest referral hospital in the Gaza Strip, and saw really unbelievable conditions in the emergency department and a hospital full of internally displaced persons. And what we were told then was that the hospital was running out of fuel. It had almost no staff, hundreds of patients, and they were sending their surgical cases to Al-Ahli Arab Hospital, which instigated our mission there yesterday. So we planned this mission initially to take fuel to several hospitals. The security situation did not allow for that, and instead we dispatched trauma kits, trauma supplies, surgical supplies, IV fluids, other medicines, clean delivery kits from UNFPA as well, to Al-Ahli, and we had hoped to go to Al-Sahaba maternity hospital, but there was active conflict in that area, and so we redirected the mission to return to Al-Shifa Hospital, still in Gaza City. So we traveled north for about 2 hours to reach Al-Ahli Hospital. When we arrived, it was very different from what Dr. Peeperkorn had seen just a few days before. It was mostly empty. When we pulled up in front of the hospital, the largest building and the building at the front had been blown out. I believe that was from activity, military activity that happened in October. And there was a lot of debris blocking the entrance. A number of people came out and helped us to unload the truck and do a chain of passing boxes to bring these medical supplies into the hospital grounds. We met with a couple of the doctors and nurses outside who told us that they only had 5 doctors and 5 nurses remaining on site, and that they had 80 patients who were sheltering or admitted, if you can use that term, in the church on site and in the orthopedic building. There was a lot of damage to the hospital itself, but the church was still intact, and the orthopedic building was still intact. So we went through the courtyard where we stepped over a hole from shelling that had happened just a couple of days before, past a row of bodies that had been wrapped in white plastic sheeting, that the doctors told us had been there for 4 days because it was so unsafe to move. And actually, I should say, as we were pulling up to the hospital, there was gunfire, automatic gunfire and small arms fire in the area, with the crowd dispersing maybe a few hundred meters from where we pulled up to the hospital. We walked through the courtyard and into the church, where we found a really unbearable scene. And you could see the pain in the eyes of the doctors and nurses who were trying to care for these patients. But a church with 30 or so patients, almost none of them ambulatory, so bedridden patients, some of them with serious trauma wounds. Some of them had been lucky to have surgery before the operating theater went down, were struggling with post-operative infections. Some of them had been injured days or weeks ago with no surgery to save their limbs and suffering enormously. We saw a young girl who had been amputated, who had lost her whole family. She lost her leg above her knee, below her knee. We saw many patients who had said they hadn't bathed or changed their clothes in weeks. The hospital staff told us that many of their colleagues had been taken away 2 days before, and that they were struggling to maintain and keep these 80 patients with no food, no fuel, no water. Patients were crying out in pain, but they were also crying out for us to give them water. It's pretty unbearable to see somebody with cast on multiple limbs, external fixators on multiple limbs, who were just asking for a drink of water. Almost no IV fluids available. It's a place that Rick said it looks more like a hospice now than a hospital, but it's a hospice implies a level of care that the 5 doctors and 5 nurses are simply unable to provide given the circumstances and what they have at their disposal. So at the moment, it's a place where people are waiting to die unless we are able to move them to a safer location where they can receive care. We visited the orthopedic ward, which is where other patients are being held. The building is intact. One man was in a stretcher under the stairs. Inside the ward, there were beds, one next to the other, with people crying out, actually desperate for us to hear their stories. They really wanted to tell us what had happened to them, how they struggled to receive care. Many of them were women and children. A woman told us that her whole family had been killed, and she couldn't get out of bed. She had nobody to bring her food. An elderly man started weeping when I spoke to him. He had been shot in the chest, in the right chest, several weeks ago, and has still not received surgery. So he was shot and is still only bandaged. A really horrifying scene. And the health workers are mostly young. Those that I saw in their 20s or early 30s, some of them junior doctors. They said that there is no specialist left. They can't perform surgery, and they have no place to send these people at this moment in time. So we delivered supplies there. but it was an unbearable scene, a huge amount of suffering. And we're now looking into how we can help try to evacuate these patients to another facility, but there's no place to evacuate them to in Gaza City. So the only option is to bring them south. And even here in the south, the hospitals are very, very full of both patients and IDPs. And the method of doing that is very challenging. We've tried to do that in the past. We've done it in the past and had paramedics, ambulance drivers detained and faced challenges doing that. So a number of barriers and hurdles to overcome. We then proceeded to Al-Shifa Hospital after delivering the supplies to Al-Afli, where we saw a situation not unlike what we had seen a few days before on Saturday. A very, very full hospital with hundreds of patients streaming in every day, many of them with severe trauma being brought in ambulances. There are a few ambulances operating in Gaza City, but mostly self-presenting. If they can walk, they come on foot. If they can't walk, they're brought by donkey cart. Some of them are brought in on trolleys and wheelchairs, carried in by family members on bed seats, or sometimes carried in on people's backs. The emergency department, as I said on Saturday, and Dr. Tedros tweeted, is really a bloodbath. It's got so few staff, almost the same numbers as Al-Afli Hospital, caring for hundreds of patients. And the hospital grounds are sheltering thousands of internally displaced persons. So the surgical building, most of the wards are occupied by IDPs. While we were at Shifa this time, we delivered medicines and supplies, including clean delivery kits that we had hoped to take to Al-Sahaba Maternity Hospital, which we weren't able to access. The good news is that the Shifa medical staff said that they would be able to transfer those clean delivery kits to the maternity hospital when it's safe to do so. So we hope that they'll reach there, but there are also deliveries happening at Al-Shifa, so they will be used there. We talked about the deployment of emergency medical teams, which we hope will help to support health service delivery and resumption of surgery in Al-Shifa Hospital, and also help to relieve the pressure on the emergency department. We have some teams that are willing to go, but the hospital leadership did indicate that bringing medicine, bringing doctors and nurses will not be enormously helpful if they don't have fuel to run the generators and if they don't have water and food for their patients. So we need the full package. We need an interagency and larger scale effort to get Shifa functioning again, to resuscitate Shifa. As one of the doctors from Shifa said on Saturday, it's a hospital in need of resuscitation. So it needs additional human resources, which we're working to mobilize. We're providing medicine, fluids, surgical supplies. But we really need to get fuel in there. It uses 10,000 liters of fuel per day. So it requires a huge uplift of fuel. And there are thousands of people there who are in need of food and water. What we also saw in Shifa on this trip was a surgical building that had come under attack 2 days before. So 12 people lost their lives on the grounds of the hospital 2 days before our visit. And I walked through the building. I stepped on the rubble in the third floor, on the third level of the surgical ward myself, and saw where some of those people lost their lives, and where part of the building is now inoperable. There were bullet holes in the surgical building and the bridge that connects it to the. And we were also told that a person was killed in the courtyard of the hospital yesterday morning before our arrival by a sniper. So obviously health facilities are coming under attack. There's a huge level of suffering within the health facilities. The health workers themselves are suffering. And what we're doing right now is trying to provide some level of relief to the suffering with the provision of supplies by surging in additional support. We hope to do fuel delivery in the coming days, and also to support some of the other hospitals that have ceased functioning for the most part or completely, and see how we can help to restart services in some of those locations after they are no longer seeing military activity close by or fighting in the area. But what we really need is a ceasefire. We need a cessation of hostilities. Health facilities need to be safe places. It's pretty unbearable to see people who are already victims of conflict, who are in what should be a safe place, where they should be able to access care, where they're sitting, waiting to die, unless something dramatically changes that will allow them to survive. That requires safe movement, requires a huge uplift of fuel, requires medicines, medical supplies, human resources. They're starving, they're dying of thirst. One woman wanted to cry out to me and speak to me yesterday, and she was unable to because she was so dehydrated. I've never seen suffering like this, particularly avoidable suffering like this. So we need urgent action. We need to stop these children and women and elderly people from dying in a place where they should be safe and where they should be cared for. We're trying our best as WHO and as the United Nations community and a community of non-governmental organizations to provide some relief, but it's not enough. I'll stop there. Eric, and hand back to you. Thank you.
Thank you, Sean, for sharing this. It's even difficult just to listen to everything what you are saying. Thanks for being the witness. We are sending you the remarks of Dr. Peeperkorn. Shortly, you will have it in your email. Dr. Peeperkorn is speaking from Jerusalem, and Sean is speaking from Rafah. We don't have a remarks from Sean. He's just like really telling us what he has seen, not something that has been prepared. So let's go for questions now, starting with Imogen from BBC. Imogen?
Yeah, thank you very much, both of you, for sharing that. You said that you wanted to take fuel over the weekend, and this wasn't possible for security reasons. Is that basically you were told you couldn't take fuel, or it's too dangerous to carry fuel? I just want to, were you just told that can't be as in part of your convoy? That's my question.
Yeah, I think Sean might want to add. This is Rick speaking from Jerusalem. So just coming back from Gaza, I think the decision was made because there was a lot of military activities just north of that. And this mission was also supposed to go to Sabaha Hospital, the MCH hospital, and Al-Sabaha hospital, and that didn't go there because there were a lot of military activities. And of course, then bringing fuel, you run additional risks. So that was the reason fuel was not taken, and the focus was on medical supplies. Maybe Sean wants to add on this.
Can we unmute Sean?
Yes. So yes, thanks. So we had planned a fuel delivery following our previous mission to Shifa, but we decided, well, the mission to deliver the fuel was aborted for several reasons. One is that we didn't have assurances in time to be able to get up to from the parties to the conflict, to be able to get up to the hospitals and back within the time that is available, within daylight hours, and clearing checkpoints and proceeding through very challenging road conditions. So I must say, when I traveled up to Shifa on Saturday, it took 4.5 hours to go about 40 kilometers. And that was with a flatbed truck with not a huge amount of supplies on it. We were going to take 20,000 liters of fuel. So we needed it to be a coordinated movement with the parties to the conflict, and also ensure that we had a safe route to pass with 20,000 liters of fuel, which is obviously a volatile commodity. And we haven't done fuel deliveries to the north in the last 3 weeks since the pause. There were also concerns that it's a high value item in a population that's very, very desperate, and that there could be potential for some kind of engagement along the route. So it was decided that we needed to validate the route a bit more, which we did yesterday. We provided those supplies, and we hope to deliver fuel in the coming days. The fuel needs are enormous. As I said, Al-Shifa runs on about 10,000 liters a day. The truck that we were planning to take is 20,000 liters. So even if we had made that trip, that would be 2 days worth of fuel for the one referral hospital. And then the other facilities we were targeting, we would not have been able to access because of activity in the area, fighting in the area. So a number of challenges, but we think that we've been able to mitigate some of those, and we'll give it another try in the coming days. Over.
Thank you, Son. Next question, Mohammed from Anadolu News Agency. Mohammed.
Tariq, thank you so much for taking my question. Yesterday, Ministry of Health in Gaza announced that the Israeli army tortured Kamal Adwan Hospital director El Kahlut and detained him. Hundreds of healthcare workers have died in Israeli attack since 7 October, and Israel is detaining now 93 healthcare workers in inhuman conditions. My question is, as WHO, what do you plan to do to protect healthcare workers from Israeli attacks? Thank you.
Thank you very much, Mohammed. As you know, we have been always calling for healthcare to be protected. But Dr. Peeperkorn, would you like to speak about this?
Yeah, I think WHO, let me explain again one of the roles of WHO when it comes to attacks on healthcare. And it is a mandate for WHO provided by the World Health Assembly, by all the member states. So WHO, in every conflict, an active conflict, an acute conflict, a chronic long conflict, WHO is obligated to monitor and analyze and report on attacks on healthcare. And that's what we're trying to do. So we always try to verify. When we cannot verify, we will always say, like, who reported those attacks, and then we will verify as good as possible. What, of course, WHO makes a point that any detention of health workers, arrest of health workers, is an attack on healthcare. And we expect that anyone who gets arrested and detained, including health workers, is treated according to international humanitarian law, and families, their partners should be, of course, informed on this. We are extremely worried that we have seen numbers of health workers, and I just want to also remind you that WHO is leading a mission to Al-Shifa that is now weeks ago, and that 6 health workers got detained on that mission. 2 were released. There are still 3 health workers, 3 from the Ministry of Health and 1 PRCS colleague were detained, and we know nothing about their whereabouts. The family, of course, is extremely worried. Their colleagues are extremely concerned, and also we as WHO are very concerned. So in that sense, yeah, WHO has a system in place on attacks on healthcare and regularly reports on this, including annually. And we will keep doing this, and we will keep raising this. And just to give you some figures, since the 7th of October, so we have documented 493 attacks on healthcare in occupied Palestinian territory, of which 246 in Gaza Strip. And they resulted in 582 fatalities and 748 injuries. So the attacks have also affected 61 healthcare facilities, including 26 hospital damage out of 36. It affected also 76 ambulances, including 38 with sustained damage. Over to you.
Thank you very much, Dr. Peeperkorn. I just shared in a chat the link to our portal on attacks on healthcare, where you can look for the period and the country and have latest numbers on what Dr. Peeperkorn was just explaining. What is the role of WHO? Next question, Nina Larsson from AFP. Nina.
Yes, hi. Thank you for taking my question. First, I just wanted to clarify something you just said, Dr. Peeperkorn, on the health workers that were detained last month. You said 2 were released, and then you said 3 remained in detention. I was just wondering, I wasn't quite clear on the numbers. Is it 3 or 4 who remain detained? And I saw that Amnesty yesterday was asking for investigations into enforced disappearances in Gaza. Would you consider these enforced disappearances? Sorry, that was my clarification, and I have a question, but you can answer that first if you want, or I can.
Yeah, I can. So I mentioned on that mission, which is now almost a month ago. So 6 initially on the way back from Shifa to the south. 6 health workers were detained. There were 3 from the Ministry of Health and 3 from PRCS. 2 were released from PRCS. 4 remain detained. So 3 from the Ministry of Health and 1 PRCS colleague. So 4 people remain detained, and their families, their colleagues, including us, WHO, we don't know anything about their whereabouts, and of course are extremely concerned. That applies, of course, to all health workers, and we're trying to get a better overview of that health workers which get detained, and when there's no information about that, we will constantly raise that. Over to you.
Thanks. Nina, you have a question?
Yes, thank you very much. So I wanted to ask about Israel has accused people of turning a blind eye to the use of the hospitals by Hamas, and some hostages have also said that they were detained in or near the hospitals. Is that something that you've seen on the ground? Do you think that's credible? And if so, why haven't you condemned that? Thank you.
Nina, no, I think we in our missions have not seen anything of this on the ground, but we cannot verify. We are not in a position to ascertain how any hospital is being used other than a health facility. We cannot verify that. And I want to make the point as well, it always comes back on attacks on healthcare. So attacks on healthcare, again, I say the role of WHO is to monitor, analyze, and report. We are not attributing the attacks on healthcare. We are not a crime investigating organization. I think that should be very clear. Thank you. Over to you.
Thank you very much. I'm just looking at the Zoom. Do we have any more questions from reporters? Here we have a Nick Cumming-Bruce from New York Times. Nick?
Yeah, thank you. I wanted just to check. You've indicated that water is in acute short supply. I mean, what is any water at all reaching any of Al Ahli or Al Shifa? You know, this must be perhaps one of the most critical shortages. Is there any emergency deliveries that you can foresee in the coming days that can alleviate that? And then a question that my colleague John Zeracostas has often asked, and I just wanted to check if you had any update on it, and that is on the scale of amputations that are being conducted, and perhaps whether you can provide that in relation to one hospital or in relation to many. That would be useful. Thank you.
Okay, maybe let me start, and I'm sure that Sean will want to complement on this as well, because they are discussing this, of course, with the one UN. The one UN in Gaza and parts of Gaza. On your last question, Nick, on the level of amputations, no, we don't have an overview of that. The only thing I could say, it's everywhere. When I was there for more than 2 weeks and visited most hospitals in the south, and specifically also the larger one, the European Gaza Hospital, the Nasser Medical Complex, but actually all the hospitals, including Al Ahli. And when I visited Al Ahli, incredibly sad thing was there were then still 2 medical specialists, an orthopedic surgeon and a general surgeon, which we both work with as WHO. We did trainings together, we know them very well. But they lacked, and I reported on that, they lacked a vascular surgeon. So they indicated they occasionally had to do amputations, which normally would not be needed if there would be a vascular surgeon. We see a lot of, everywhere around, a lot of amputees, men, women, children as well, lots of children. And we don't have an overview. We should get an overview. We're working, trying to work on that. I also want to make the point on what you said about the water, and Sean will get in on that. Currently, and this is, I think, is also a real problem. We talk about getting more aid, humanitarian aid into Gaza, and there's a little bit of good news with the opening of Kerem Shalom, but it's still not enough. It's absolutely not enough. The big problem is getting it then specifically to the north. These missions, as Sean already described, they need a lot of planning. They need a lot of deconflicting, and even then it's not completely deconflicted. They need constantly to change routes and roads, and very bad roads. Going over 40 kilometers and sometimes taking 4 or 5 hours, etc. That's a reality. Checkpoints, etc. So it's very difficult to organize these missions, and that is why of course a humanitarian ceasefire is incredibly important, but also to make sure that those missions can take place not once a day or once every 2 days, but there will be multiple missions to the north, that warehouses can be set up in the north, that storage facilities can be set, and from there you can distribute food, water, and other supplies. That's not there at the moment. So it's all haphazard. And I would say the UN doing what they can do. Maybe Sean, you want to add on this a little bit, how you're currently discussing this at JOC. Over to you.
Thanks, Rick. Yes. So first on the water, I'll speak about water and food, because even within the hospitals, patients who are severely injured are crying out to us for water and food. So and even as we walk on the streets, we're at, in the hospital yard, everybody's asking for water and food. And yesterday when I was in Al Shifa, I was asked, they said, "Oh, you're back again, Sean," by just people who happen to be in the courtyard, and they said, "It's great that you're bringing medical supplies, but we need food and water." The challenges are many. One is that the level of desperation is huge, and the numbers of people in need are huge, and so doing orderly distributions of food or water is very challenging. There's lots of security concerns around doing that. The planning that Rick mentioned is complex, and the scale is enormous. And so we can bring tanker trucks of water, but it will be a drop in the bucket relative to the need. One of the efforts that's underway by UN colleagues is to support fuel delivery to the desalination plants in the north, so that some water flow can be established, potable water flow can be established there through that. Also working to address the sewer system in the north so that the water sources can avoid being contaminated. On a related point on water, in Gaza, a lot of the groundwater has high salinity, it's salty. So even with filtration systems, it's not potable. And so there's an issue in terms of the water sources here, and in terms of the scale and complexity of delivering, particularly to places like northern Gaza. On amputations, I think what Rick said is correct. We see amputees everywhere we go, and unfortunately, many of them are really unnecessary, what would be considered unnecessary amputations in the rest of the world, and where there's capability to save limbs, where there's orthoplastic, there's vascular surgical capability. That's not there. There's no surgery happening right now in northern Gaza, and so actually many of the patients that I saw yesterday will need amputation when if and when they are able to access surgical care. But we saw limbs that are not salvageable. And people may die of the infections that they have because their limbs are infected. And we saw patients who were septic and dealing with serious complex infections. So there are a huge number. We don't have a clear tally. Many of them, unfortunately, are last resort amputations to save a life if you can't save a limb. And it just, as Rick said, speaks to the need to have a humanitarian pause so that we can bring in the teams and the supplies and the fuel to make surgery possible, evacuate these cases to a place where they can be safe, and hopefully save some of these lives and save some of these limbs. But it's not just about the number of amputations, it's also that we're talking about small children who have lost their legs, who lost both of their legs. We're talking about elderly people who have lost limbs, who have nobody to care for them. They can't move. They're really bound to their bed, and they can't, even if there was a water distribution, even if there was a food distribution, they would struggle to get to it. So there's really layers to this, but it's a horrible scene where there's lots of amputations. There's lots of amputations that are becoming infected because there isn't even water to manage the post-operative care. I'll stop there.
Thank you very much. I'll just go in order of hands that we have. So we have more questions coming. Lisa Schlein, Voice of America.
Tarek, yes, good morning. Thank you to you and to you, gentlemen. A couple of questions. One, there have been increasing warnings about people at risk of starving to death because of lack of food and water. And also that it's likely that more people will die from disease than from bombs the longer the conflict goes on. I'd like to ask for your response to that, whether you believe that, sorry to use this phrase, but whether this is a ticking time bomb, how much time actually is available, is left to respond to the needs of the people before it does reach a point of, well, horrible no return. Thank you.
Thank you, Lisa.
Yeah. Let me start, and then maybe Sean might also add to that. Like for me, already just coming back to Jerusalem and what I witnessed, and I want to make that point very clear. So Gaza, before this crisis, had a reasonably functioning health system. And I told it as well. It had health indicates par with their neighbors. Also, when you look at nutrition, yes, there were some groups of the population with what we call food insecure, but it was limited. We mainly talked from the health point of view, we talked about micronutrient deficiency in some areas, iron, etc. Pregnant women, iron deficiency, etc. But they were very limited. And already what I saw over the last couple of weeks, you could see that the food insecurity is becoming a major topic. Now, I understand that the IPC and FRC will actually raise much more detailed information about that, and hopefully today, or at least in the coming days. They're experts on that. But what we already see that, and you've seen it also on news from WFP. They conducted this rapid food security assessments following the significant deterioration of food security situation in the south of Gaza, and also the large influx of IDPs. 1.95 million people are IDPs, and with resumption of hostilities, and very, very high levels of hunger levels, and were reported on let's say extreme and large part of the population, extreme food insecure. And we will get more data on this. Now, And the proportion of IDP households, not only IDP households, also non-IDP households, I think, going to sleep hungry or maybe have access to one small meal a day is increasing, and it's increasing from the IDP was already increasing 34 to 50%. So it's a major concern, and that's in combination what you actually said with the huge number of, not only in the UNRWA shelters but also in these makeshift shelters harboring 1.95 million people. The washroom sanitation conditions are completely below par, and the water consumptions, I mean, like unsafe sources, etc., persist. And even more in the north, as just described by Sean and myself, where the water desalination plants are not working, etc. So what we also see, and we try to monitor, and I must say UNRWA, WHO is trying to assist as good as possible. It's difficult to monitor, but what we have seen is lots of acute respiratory infections. We're talking about 170,000 cases, a lot of scabies and lice, 50,000 cases of diarrhea, over 125,000, and under 5, 61, 62,000, which is way more than normal this time. Skin rash, chicken pox, jaundice, close to 4,500, which is actually very worrisome for hepatitis. I mean, like, is it hepatitis A or is it E, which is much more grave? No lab capacity to actually, because it's all destroyed, non-functional. So WHO has just got in some lab kits, testing kits, and we'll try with UNRWA to set up an early warning and response system. So the routine surveillance system, which was working pretty well in Gaza, has been completely hampered. It's not working currently, and many of these people, the people with no access, will go undiagnosed. So the situation is probably worse than it seems. An area of vaccination, routine vaccination. Gaza had a fantastic coverage in routine vaccination, better than most countries around the world, close to 100%. Now, so at the moment, that's maybe not a risk, but very quickly that will become a risk. And think about measles epidemics, what you get, and when this is not addressed. So yes, we are very concerned. We have not yet seen major outbreaks, but of course we are actually simply waiting for them. If this doesn't change, if the access is not improving, if the supplies are not improving, if the shelter conditions are not improving, if the water and sanitation conditions are not improving, if the access to health services and healthcare is not improving. I don't like the phrase what you mentioned, ticking time bomb. Yes, but it definitely is. Over to you. Maybe Sean, do you want to add something from the field currently?
I'll add one brief point, which addresses the question of when is it too late? And I think it's too late. We're behind. There is not enough food. Every single person I speak to, everywhere I go in Gaza, is hungry. The time is now. We are dealing with starving people now, adults, children, and it's unbearable. Everywhere we go, people are asking us for food. Even in the hospitals, as I said, I walk around in the emergency department. Somebody with an open bleeding wound, open fracture, they ask for food. If that's not an indicator of the desperation and I don't know what is. We move around Gaza to deliver medical supplies, and people rush towards our trucks hoping that it's food. And when we say that it's medical supplies, actually they clear the way for us. They help move debris out of the road. But everybody's just constantly on the lookout for food. So there's efforts underway with the One UN to look at cash options. In some parts of Gaza, there is food on the market, but nobody has money to buy it. In other parts, there's really nothing on the market, and there's an urgent need to bring in flour and basic food stuff. So, yeah, I think we're behind on a lot of things here in Gaza. There are hundreds of trucks sitting in Rafah. As Rick said, it is good that Keren Shalom is open, but we need more food to come in. The private sector, the commercial trucks also need to come in. Cash needs to be put in people's hands, and that will address some of the food crisis, but we're seeing the consequences of it already in the hospitals and in our daily interactions with people across the Gaza Strip. Over.
Yeah, and I want to add on that. There's what Sean said. There's no economy going, so the private sector is of course key to get that reactivated again. And we've raised this, by the way, many times over the last couple of weeks. I mean, if this is not a real big indicator, every hospital you go, so there's a lack of food for patients, but there's also a lack of food for health workers. So health workers, they have to scavenge around and they have to spend their time. At the moment, probably we estimate that less than 30% of the 25,000 health workers in Gaza is actually operational. Because everyone, and that's including from our own staff, the WHO staff, we have 1/3 who is still incredibly operational, but a lot of other people are just say they're in a mode of surviving. They're focusing on surviving and focusing on what can we get from the market. There's no money around, so there are still some farming done. I've seen some farming in the middle area and in the southern area, etc. But of course, then there is no economy. People cannot access. So it's everywhere. There's talk about foods and people ask for food and water. And every time we brought in a truck of medical supplies up north, in the south, etc., we had to protect those trucks and constantly raise out our voice. Hey, these are dawa, these are medicines, these are medical supplies for hospital X or hospital Y, because people jumped on those trucks to see if we were not lying, if we were, if there maybe was water and supply, and that truck would be empty in no time. That is the reality in the ground, and I think sometimes I feel that voices are not heard enough. The misery is so much larger than I think what people think. Over to you.
Thank you both. We have 3 more questions, 3 hands. Jamie Keaton, Associated Press. Jamie.
Hi, Tarek. Thank you very much. I just wanted to know thank you very much for all the detail about the food and water situation. Do you have any numbers about the people that have actually been treated for malnutrition? Is there any sort of metric or gauge that could indicate? We did it, and if it does bear repeating, the numbers that WFP has provided, of course, which the other day saying that 90% regularly go an entire day without a meal, and half of Gazans are starving. Are we getting close to a famine-like situation there? I mean, that sounds like it could be in the offing with those kinds of numbers. So basically, my question for you really is just about the treatment for malnutrition and anything you might say about those other figures. Thank you.
Yeah, thank you. It's a very good question. At the moment, so I think you also say even the 1UN and the 1UN, the various clusters, etc. We talk about relatively small numbers with their partners, trying to focus on the priorities. So for WHO, the priorities: how do we make sure that the hospital, the health system, which is on its knees, how do we make sure it's at least keeps on providing basic health services? That's our key priority. That's what we focus on. And we try to get a sustained supplies, medical supplies, essential medicine, etc., to those facilities, which is already incredibly difficult to do. Now, with these figures coming out and what we have observed about the situation around hunger and malnutrition, food insecurity, extreme food insecurity, yes, both the health cluster and nutrition cluster, they want to work first with the primary healthcare facilities, just what always should be done, and under 5 clinics that you do, middle upper arm circumferences, etc., that you set up a system. That you also do that try to get it and do that in some sentinel sites, in some of the shelters and some of the makeshift shelters. Plans are made currently to do that. But the first priority should be that there should be a sustained flow of food and water and reaching everywhere within the south, within the north. That should be the key priority. And yes, we need to get better data on this. Work is being done by the nutrition cluster and the health cluster. Sean, you might want to add something on this.
Thanks. I'll just say, I mean, we're struggling with numbers on a number of fronts because communications was down for much of the last week. I mean, we have very often no cell signal. People in the north, actually, when I go to the north, people ask me what's happening because they don't have internet access. They don't have cellular service. They don't have any visibility on what's happening outside of the small area where they're staying, where it's safe to exist. And as a consequence of that, we have limited reporting. We have people who are unable to access services to even get screened for malnutrition. We have challenges in transporting therapeutic foods to the north because supplies are sometimes compromised. Trucks are looted. I hate using the word looted because looted implies criminal intent, but there are desperate people who are looking for food who will, as Rick said, jump on the trucks and they're desperate to eat something. So we have challenges just in the security and transport of therapeutic foods for young children and infants, and challenges in getting information, and challenges for patients themselves, for mothers to take their babies, parents to take their small children to a clinic because there's fighting in the area and they don't feel safe moving from whatever location they happen to be in. That's all.
Thank you both. Next question, Catherine Fiancambo-Conga from France 24. Catherine.
Thank you, Tariq, and good morning. Thank you to both doctors for meeting us this morning. I have two questions. The first is to Dr. Sean Casey. He spoke about amputations that could have been avoided in normal circumstances. So, doctor, could you give us a percentage of the amputations that could have been avoided if we were in a place where people could get access to normal hospital services? Or Dr. Richard Peeperkorn, one of both of you. And I'd like also to know if you have some more children that have been evacuated. Could you please give us more details on that one? Thank you to both of you.
Thanks. I can comment on the amputations. I mean, the simple answer is no, I don't have the numbers of limbs that could have been saved. I think the hospitals that are functioning, particularly in the north, but even here in the southern part of the Gaza Strip in Khan Yunis, they're absolutely overwhelmed. I mean, hundreds of patients coming in every day with serious injuries, and staff who are not able to access the hospital. So not long ago, I was at European Gaza Hospital where they said the staff who live across the road, 500 meters away, are unable to get to the hospital, and consequently they're unable to perform some of these very simple procedures, actually, not just amputations, simple procedures that would save lives. So people are dying. The doctors told us at European Gaza Hospital and at Doctor Medical Complex in Khan Yunis and as well as in health facilities in the north, that people are dying because there are not the providers in place to provide care for basic illnesses and injuries that would otherwise be very treatable. So we don't have a hard number, but I can tell you in every hospital that I've been to in the last 2.5 weeks, I've seen patients who have had amputations, who have lacked access to care simply because the providers are no longer available because they've been displaced. They've had to flee because they are scared to go to work, or they're scared to leave their families to go to the hospital, and that they may never return. They may not be able to get back across the road. So no firm numbers on it, but it's a common occurrence, unfortunately, that we're seeing, that people are really struggling to access basic care, and they're dying of things that they shouldn't die from, and they're losing limbs that they shouldn't have to lose because of these access constraints and because of ongoing conflict. I'll hand over to Rick maybe on the evacuation.
Yeah, and maybe to add on one thing on the amputation, I think for me, it was more than telling that true. incredibly well-trained medical specialists a week ago when I was in this Al-Ahli hospital, straight away told me that, like, hey, I'm an orthopedic surgeon, my colleague, and we know him as a general surgeon, we do not have the skills. I mean, like, we are not vascular surgeons. So we have done and will be doing amputations when that should not happen. That's, I think, is for me more than telling. On the evacuation of patients, so as WHO point of view, we think that many more patients should be evacuated out of Gaza. And we know that Egypt is ready for that, and they've raised Egyptian government and ERC, etc. And we're very grateful for that. But it has to speed up and increase. And including there are other countries in the region which are willing to also assist with accepting patients and their companions, when they are in need for referral. And I'm really literally thinking about hundreds, maybe even thousands of patients over the next month, which should be referred. WHO, we were together with the Egyptian government, the ERC, and that was already a couple of weeks ago, where we facilitated with St. Jude's Hospital the transfer of a number of, I think, 30 children with cancer, and to Egypt and from Egypt to other places. But much more is needed. I also want to remind everyone that before the crisis, that on average 50 to 100 patients a day, 5 days a week, would go for referral care to East Jerusalem Hospital, or to East Jerusalem, to the hospitals there, or to the West Bank. 40% of that was oncology related, pediatric oncology, adult oncology, etc. Those patients we don't even talk about anymore. We only focus on trauma, and say therefore, because they're so overwhelmed. But that's another group of patients, the patients with non-communicable diseases, which cannot be treated in Gaza, oncology patients, etc. So we need to. What is needed is a much better medical evacuation outside Gaza into Egypt, and when needed from Egypt to other countries in a more organized way. And there's literally a need for hundreds, probably thousands of patients. This would also help to decompress the completely overwhelmed healthcare system. Every hospital, we talk about three times as many patients as their normal beds, and all the ICU. And a last point, which I've never seen in any conflict, but the many patients which could be discharged, patients are afraid to be discharged. They don't want to be discharged because they are afraid to go back to where they come from. So they linger around in these hospitals, and it's like some of the hospitals said, it's very difficult to get rid of these patients. Over to you.
Thank you both. We have two follow-up questions from Nick and Katrine, so let's do those and try to be short. Nick?
Yeah, this is a very short one, and perhaps the answer is rather obvious, but maybe you could just explain what are the constraints on evacuation of patients at this point? How much of this is down to the fundamental insecurity and continuing conflict, and how much of it is due to, if you would like, bureaucratic procedure or political will? Thank you.
Okay. I would expect the political will is there, and people talk about it all the time. So I think it has to be implemented. I mean, like, I hear this from all sides. The political will is there to organize a better medical evacuation. I think it's a lot of the procedures that has to do partly with security and screening, etc. But for me, that's not I don't want to go there. I mean, we see what is needed, and many more patients need to be evacuated on a regular and a more organized way. What we hear and see is like 20 to 40 patients sometimes a day. That is way too 20. That's way too little. We've seen lists of patients which are much longer than that, and it should be facilitated. I understand everywhere when I listen that the political will is there, that the resources are there, that the hospital facilities are there on the other side. So let's just do it. That would be my plea.
Thank you. And let's go to last follow-up question from Catherine. Catherine?
Thank you, Tariq. In fact, the follow-up is regarding the French floating hospital that was initially supposed to dock off the coast of Gaza. So I'd like to know if you work with this hospital, and I know that the hospital is in Egypt for the moment. Is it possible for any boat to dock off the coast, or did the Israeli bombing damage, in fact, the Gaza port?
Yeah, okay. I'm not a docking specialist or a specialist on ships and boats, etc. But first of all, the issue is not about boats in front of the Gaza coast. That's not going to help. The medical evacuation to Egypt can be organized and should be organized. From there, that's the second step. Can Egypt, and I think we're very grateful for that. They are ready to receive many more patients. Hospitals are ready. And if there's need to refer from Egypt to other countries, and there's many countries in the region which have offered that we heard from Qatar and from Iraq and from the UAE and Turkey, for example. They all are ready. We heard from some European countries that they are ready to if needed, to accept. So then maybe, I don't know, maybe they can then go from Egypt to that boat. I don't care, but I think the best way possible is to get out of Gaza into Egypt, and from Egypt either remain into Egypt. There's a lot of good services available in Egypt, or when needed, go to other countries, third places. That should be the focus.
Thank you, Dr. Peeperkorn. Sean, would you like to add something to that?
Thanks. Yes, I'll just add. I mean, as Rick said, it's about getting out, and there's plenty of destinations. But I think the fundamental point at the moment within Gaza is that we have 20% or so of hospital beds functioning. We have a huge reduction of staff available. There are basically no beds available. There's no room for patients to move within Gaza. The biggest referral facilities in the south, which are still functioning, are 200, 300, 400% capacity. So internal referrals are occasionally possible, very complex, but international referrals are absolutely needed. We're scaling up bed capacity. My role here as emergency medical team coordinator is to help bring in field hospitals and expand bed capacity within the hospitals. We have the ICRC at European Gaza Hospital adding beds within the hospital and adding a field hospital next door. We have a number of emergency medical teams setting up additional beds, but it's not even coming close to the number of beds that we've lost. And so we've lost beds, and at the same time multiplied the number of injured and ill who need hospital beds. So they can't wait. The people that I saw yesterday and on Saturday in Shifa, yesterday at Al-Ahli, they can't wait for 2 weeks or 3 weeks for additional beds to open or new hospitals to be built. They need to be evacuated now. They need care immediately. So we're working on some, extreme cases. If we can move them to a hospital here in Rafah, for example, that can accept 1 or 2 patients, that's great for those 1 or 2 patients. But there's hundreds or thousands more behind them, and there will not be enough beds in the short term to meet that need, especially with, as we've alluded to, some of the very complex surgical cases that need care, that require vascular surgery, orthoplastic surgery, reconstructive surgery. We've seen serious burns. Those are very complex cases that just can't be cared for within Gaza at the moment. There's no hospital that has that capability.
Yeah, maybe, Tariq, if I may add to what Sean just raised, I think this is what we have tried to push for weeks. Is that, of course, what we call as WHO the protection of healthcare. And I think what has happened in the north can absolutely not be a blueprint of the south. So in the north, we're talking now about 4, minimal barely functioning hospitals. They're more like first aid centers. So we need to help to make those hospitals functional again, because there's between 200,000 and 600,000 people in the north. And the first focus is, of course, to make Shifa a resuscitate Shifa hospital again. So that should be happening, should be allowed. And then you talk about fuel, you talk about medical supplies, but you also talk about emerging medical teams. And emerging medical teams are willing to go to Shifa and to assist the current staff. So that is for the north. That should happen immediately, as soon as possible. Make sure that there is a minimal level, basic level of healthcare available in the north to serve the thousands of remaining people. Now, in the south, we currently talk about 7 hospitals, extremely overwhelmed, but they are the backbone of this 1.92 million people. They are now the backbone of the health systems. And we have to make sure that not only to keep them functional and to restore, we also have to make sure that what Sean is trying to do and help to that emerging medical team come in and are linking up to those hospitals. We have a good example. ICRC is in the European Gaza hospital, and they are plans to expand that hospital with another 150 beds. Now, that needs to happen in Nasser, close to Nasser Medical Complex. The Jordanians have a field hospital. Even Nasser Medical Complex will need an emergency medical team to assist to expand the number of beds. As a Nasser Medical Complex and the European Gaza hospitals are like what Shifa was for the whole of Gaza Strip. They're the third level hospitals, and they need to be functioning constantly. Now, we are very concerned but we also see much more military activities in Khan Yunis, very close to Nasser Medical Complex, and we already saw one of this tank shell landing on Nasser Medical Complex, killing actually an amputee girl in that hospital. And there's many IDPs as well in that area. Now, they're getting concerned. They say, "Oh, is the Shifa scenario repeating here? And you know, do we have to even move further?" The same if you talk about the middle area and around Al-Aqsa Hospital there, and Deir Bella, thousands, hundreds of thousands of IDPs. Now, so there's two things: this hospital's infrastructure, this vulnerable hospital infrastructure on its knees, needs to be supported and strengthened with additional hospital beds, with EMTs, but also, and I want to say, to help improve beyond trauma care, to help improve the access to reproductive, maternal, newborn, and child health, treatment of communicable and non-communicable diseases. And we don't even talk about mental health or psychological support services. We have to do this in a much broader way. And very concerning that if military activities are continuing in that area, Khan Yunis, they will come to the middle area, we will probably see more influx of IDPs coming from those areas to the south. And well, we can all describe the situation in Rafah, a town of 230,000 people normally, and they have over 1 million people, probably more than 1 million IDPs already sheltering in the town. All these makeshift shelters. There's no space. So I can understand why people don't want to go, because there's no space. Where do you want to go? What is safer? So there is nothing safer. So you don't want to go in a place where you don't have any shelter, and you have the same problem. So this should be prevented, and the almost a plea from us: the health care services need to be protected in the south, and we need to get it going again in the north, starting with making Shifa again at least work as a first level hospital, and maybe then after that again to a second and third level hospital. Over for me.
Thank you, Rick. I understand that Sean has to leave, so Sean, we will let you go. We are well beyond the hour and 15 minutes now, and we don't really want to abuse also the hospitality of our colleagues at UN Information Center. I have one hand from John Zarkostas. So Sean, if you have to leave, please just go. And Sean, John, please ask your question if it's possible, just to be very brief.
Yes. Good morning, Dr. Peeperkorn. I was wondering if you could give us a bit of an outline what is your relationship with the Israeli authorities, and what responses are you getting when you're asking for the access to the various facilities? What are their responses? Just to give us a bird's eye view. Thank you.
Well, it's not just my relationship, it's the one UN, and I think the one UN is coordinating with all parties to the conflict as good as possible, and that is on a very I would say direct and an intent way. So that's happening at levels above me, but it's and we are also all operational UN agencies are constantly reaching out. We do this in a coordinated fashion with the one UN and Gaza, UNRWA, and OCHA leading in these processes, both in Gaza as well in Jerusalem. So there's a whole system in place. The issue is what I think I said that from the start, that specifically going up north, when there's a lot of military activities, when there is roads are destroyed, when there's a lot of insecurity, for any convoy, and specifically when we talk about larger convoys which we would like to send up north, convoys which would include fuel, food, water, medical supplies, it becomes incredibly difficult to plan for that. There's constant planning ongoing, there's constant interaction. But the reality on the ground is that we plan for convoys, they often get delayed or they take a lot of time and they are very high risk. So these convoys need to be properly deconflicted. It should happen in corridors that they can move quickly. So there's a lot of work on that. Some progress has been made, but it has to be much better. And we struggled, for example, with larger convoys. We tried to plan a convoy both with medical supplies and with food and water. And it is difficult to move around. So the final decision was we have to keep this convoy small and agile. It's another issue, for example, where the UN is struggling with something very, very simple. The number of AV vehicles. We need to increase our armored vehicles to do those things. We struggle to get them in, to get permission for that, and to get a constant flow. PPEs, it's absurd that in such a large, and there's such a large need, and this is going to be such a large humanitarian operation that we struggle to get AVs in and PPEs, etc., and get more staff in. And that, of course, has everything to do. All of that is related to the volatile security environment. Over to you.
Thank you very much, Dr. Peeperkorn, and thanks to all reporters who were with us this morning.
Yeah, sorry, Tariq, I need to leave as well.
Yes. Well, thank you very much. We are really concluding. Thank you, Dr. Peeperkorn. Thanks also to Sean Casey, who had to leave as well. Reporters, thanks to reporters who were with us, and thanks to our colleagues from UN Information Service for facilitating this press briefing. I wish you all a nice rest of the day.